Welcome to Grow Them Right, podcast where we discuss how to prevent health issues from infancy. I'm Dr. Roche, dentist and a mother of two. As a dentist, my expertise are in oral health, and I'm committed to continuing education. I also have a keen interest in preventative health. So in this podcast, I ask questions of experts, explore their insights, and discuss practical tips on how we can help our children grow healthy and strong right from the start. The whole idea for this podcast is to elevate the conversation and allow you, the listener, to make more informed decisions. I need to emphasize that these podcasts are not a substitute for medical advice. If you have any specific health concerns for you or your loved ones, please speak to your own medical professionals. I hope you find this space useful, and if you do, please take a second to subscribe and share with your friends. And together, let's grow them right. Fussy eaters, difficulty breast and bottle feeding, and speech and language development issues are some of the things young parents are challenged with. These challenges are overwhelming and put a lot of stress on young families. To speak about this today, I have speech pathologist Dr. Emily Lively here to shed some light on how, when it comes to feeding and language, we can grow them right. Welcome to the program, Emily. It's a pleasure to have you here.
Thank you, Rosh.
So you have extensive experience in speech pathology. You've done a PhD on it, and you've had your own practice for 10 years, and you've been working in the field for 20 years. Can you tell me a little bit about what you do, first of all?
I have been a speech pathologist for 24 years and originally started out in country South Australia, moved to England, worked all over the UK, so worked across lots of areas of child development, has always been my passion area. And through that, my interest in childhood feeding and eating difficulties arose. I worked with a lot of populations who had neurodevelopmental concerns, who had motor concerns, who had, babies who were born really prematurely, who had difficulties safely swallowing. Mm-hmm. And that kind of piqued my interest, and through that I then started to go into this field of speech pathology that is becoming a lot more well known around infant feeding and paediatric feeding and mealtime challenges. And I guess it culminated last year. I completed my PhD after 8 years of part-time study and full-time work. My specialty area, I guess, is children who are fed via nasogastric or PEG tubes.
Gavage also is called?
Yes, who actually can't swallow safely or have never learnt to swallow, have never learnt to eat. So looking at how we actually teach those children to eat and drink safely is my passion area. But my practice, as you said, Lively Eaters Feeding Therapy, has been around for nearly 14 years, and we work with children and their families across all ranges of feeding and eating difficulties, whether it be children with restricted diets, sensory processing challenges, autism, cerebral palsy, Down syndrome, a range of neurodevelopmental challenges, a range of complex medical issues. We work with fussy eaters who, parents are just struggling to increase the variety that they eat. From birth to 18 years is what we specialise in.
What an incredible service you render the community. When it comes to feeding issues for infants, do you see an upward trend in the years that you have been working in the field?
Whether it's an upward trend or whether it's more awareness of, I'm not sure if my baby is, learning to eat at the right time, or they're still struggling to move from breast or bottle feeding to solids. Whether it's that people are more aware that children might be a little bit fussier. I don't know what the statistics are on, upward trends, but it certainly keeps me out of mischief, and my 20 colleagues that work in the practice as well keeps us out of mischief in terms of being able to support families with these difficulties.
So you see that the parents are far more aware now as to what the children need to be doing or how they should be eating at certain milestones?
I think so. I mean, I remember when I was little, my cousin used to only eat chicken nuggets and chips, and I just vividly remembered that, but I never knew that there was any backstory to it. And it wasn't a concern and it wasn't a worry. It was just what they did. I
had one too.
Yeah. And I think now with, a lot of focus on nutrition and growth and development and optimizing children's learning, it is concerning for a lot of parents if their children have limited diets or won't try new foods or might actually be scared to try new foods. So it's something that parents are certainly seeking help for now.
So what is it, some of those early signs? Say, for example, I mean, this is Grow Them Right. This is aimed for the benefit of young parents. And, you've got this tiny infant and things that might be right, might not be right, things that they're really scared, unaware of how to deal with it. Some of the challenges that we have in the first few months that parents might become aware of. Maybe we just expand on that a little bit.
Yeah. I guess some of the early signs around, is the baby able to breastfeed or bottle feed, depending on what the parent's choice is. Are they able to sustain a feed? Are they able to suck and swallow and breathe in a coordinated pattern? Are they growing? Are they content after a feed? Are they able to then rest and sleep and get ready for the next feed? Sometimes we see very unsettled babies who are on and off the breast or the bottle. They can't latch, consistently for sustained periods. They're not content. They might be crying a lot. They might be quite refluxy babies. And so I guess having a look at, well, do they have a functional suck that's actually, the best for the way that the parent is trying to feed them, would be something to have a look at. As they move on into introduction of solids, somewhere around 4 to 6 months of age, depending on their developmental readiness. Are they showing interest in, mum's putting something to her mouth? Is baby watching that food, to the parent's mouth? Are they reaching out for foods? Are they mouthing their fingers lots? Are they putting lots of things in their mouth? We see a lot of children with later sensory processing challenges who never actually mouthed anything as a baby. They didn't put their fingers or a dummy in their mouth. They didn't pick up toys. They didn't try and put things in their mouth. And we know in that period from, 6 to 12 months, when the mouth is, at its most orally sensitive and all those sensations are starting to be processed by the brain, that's when we want the, babies to be mouthing things and learning that actually it's okay to have this in my mouth. This is what it feels like. Doesn't make me gag. It's safe. I'm okay with this. Because that then transfers into later texture progression if we're talking about food, going from those smooth foods to lumpier foods to foods that you need to chew is all around the mouth being able to tolerate that, those different oral sensations.
So if a child then has this sensory processing difficulties, is there a way for parents to know this earlier? Is there any tips that they can do to, say, desensitize the child so that they are more, encouraged to have the different textures later on?
Yeah. And I guess if we're talking about sensory processing, it might be oral, it might be how they process information in the mouth, it might be how they process sound information, how they process touch information. So we'd be encouraging young babies and toddlers to be exposed to mess, to have their fingers in sand, in mud, in Play-Doh, in paint, in lots of different textures, to walk around barefoot, to get their feet used to having different sensations, to be exposed to different sounds. Obviously, we don't want to damage their eardrums, but not avoiding the vacuum cleaner around them, or not avoiding running the food processor with them, because, we want the children to be learning that these sounds are actually okay. And they're safe.
Fascinating.
We want them to be exploring their their mouth with their, with their fingers and their hands, rather than being told, take that out of your mouth, don't put that in your mouth.
Mm-hmm.
I know that there's some concerns from parents, particularly with COVID, of, picking things up and putting it in the mouth.
Yes.
But that's how babies teach themselves that this is actually safe. And this is a good thing to do.
Because as a society, we've become germophobes.
We have become germophobes.
So do you think that children can deal with, if there are germs on various things that they might put in their mouths, their body can deal with it? And does that actually boost their immune system, you think?
I probably couldn't go so far as to know the evidence on that, but certainly, when I grew up, when our parents weren't germaphobes.
My kids had the 3-second rule.
3 second, I had a 5-second rule. So, but children, a lot of our children that we work with go to childcare. Mm-hmm. There's lots of bugs at childcare. Children seem to grow that immunity after they've got through their first winter at childcare, don't they? Unless they're medically compromised children, we need to be more careful.
Of course.
Our extreme premature babies and some of the medically compromised kids, obviously, we don't want them getting sick if they don't need to be sick. But in general, we want early exposure to a lot of sensory experiences to help the child's sensory system recognise this is actually safe and okay. And some children won't actively do that themselves because they do fear that this is something dangerous. I can't put it in my mouth because the sensations I'm going to get are just too big and I don't know how to cope with them, so I'm not going to do it. So gentle ways that you can encourage that, even if it's massage, around your baby's face, lips, into their gums.
Yes.
Gentle, little toothbrushes or little finger toothbrushes with tiny little soft bristles that you might just do some gentle massage, gentle rubbing of the gums or teeth, wet flannels, just experiences that are really kind of gentle and calming, but involve the mouth, the tongue, the lips, so that the children start to tolerate that.
And in that sense, because, I treat babies with severe tongue ties, and I find that sometimes there's just so much tension in the muscles surrounding the mouth.
Yep.
And when we go in there and we start to perform these massages, we find that the function gets a lot better because the tension in the muscles is also reduced.
It's also the tension in the whole body. Sometimes they're compensating around the mouth by tensing up every single muscle.
That's right.
So actually, just an overall, let's just.
And you sometimes observe that when they're breastfeeding, that they tense up, and it could be because they're just putting so much effort in, and maybe compensating even to function. This, what you were talking about, connection to nature and introduction of various textures and sounds and being able to be out in the mud and in the garden or on the beach. This goes back to your passion, which is a holistic approach in looking at this issue. So do you find that now that we are using electronic devices, far more than, say, a decade or 20 years ago, we are seeing more incidents of children delay in language or more issues with feeding?
Absolutely.
We are seeing that.
It's massive. So particularly around mealtimes, for example, we have a lot of families come to us with concerns that their child will only eat if they have the iPad in front of them. It's the only way that they can distract their child to be able to eat. We know that distraction at mealtimes gives children an opportunity to tune out of everything in front of them. You know yourself, if you're at the movies and you have a big bowl of popcorn, you are just going to keep eating it because you're not really aware of what's going in your mouth and how your tummy's feeling. It's a little bit the same for children who have mealtime challenges. It's just, let's find a way to get it in their mouth and get it into their stomachs, which makes it really difficult to introduce anything new because they're not attuned to it. They're not. It's just, to them, it's different. It's no, in terms of language development, in terms of socialisation, in terms of interaction with the family. We see so many children on devices, young children being given phones to sit in the pusher or the pram or the shopping trolley to keep them entertained, whereas what they should be looking at is the environment around them, listening to the people talking around them, watching, mum or dad putting the shopping into the trolley, naming the apples, naming the, toilet paper, whatever it is that's going. So they're hearing that language-rich environment. At meal times, having the language of the family, what happened at school today, what happened at work, what are we going to do on the weekend. From a young infant, them sitting in the high chair at the family mealtime, to just be engaged and exposed to that language is so powerful. And it's one of the first things that parents tell me when we've actually weaned their children from tube feeding to eating. The biggest change they notice, other than the fact their child can now eat, is their language development, because they're now using the same muscles. It's the same muscles we use for eating as it is for talking. So anything that's going to help strengthen those muscles is going to give us a better opportunity to develop sounds and words. But just being in that language-rich environment 5 times a day, breakfast, morning tea, lunch, afternoon tea, dinner, these children are exposed to the language and the world around them, and to social interactions, to expectations that they might have to sit and wait. It's okay for kids to sit and wait. They don't have to be entertained with the device, the second they cry.
Yes.
And so there's a big link there.
And it just goes back to the health and well-being of the parents, especially moms, who are the primary caregivers in those early months of life, and how well they are. Because, if you are exhausted and if you're tired and you can't really deal with a crying child, you're going to shove that dummy in and you're going to give that device to them.
Absolutely.
And you're just going to, take a little moment for your own sanity.
Yeah.
And I've always wondered how are we supporting moms and dads in achieving their own mental health before they can
help others.
Put your mask on before you help somebody else.
Yes, I agree. And I think there's much more awareness these days of postnatal depression or families struggling with really tricky babies, and particularly those who've had birthing experiences that they weren't expecting. And I think the old saying of it takes a village to raise a child is really powerful in terms of being able to reach out to friends, family, colleagues, whoever it is that can provide a little, bit of support to the family. And I guess when I work with families, I always want to understand the reason as to how they've got to where they've got to. Every family gets to a point of using whatever strategy they use for a reason. And if we can go back and unpack some of those reasons, as you said, is it that mum's not coping? Is it that the sound of a crying baby just absolutely sends them into anxiety because that's the sound of their baby in the intensive care unit, or, what those experiences are, and if we can support through mental health supporters, mental health workers, we can support these parents to actually unpack those experiences so that they can, move forward from them is really important, rather than just saying, well, don't give them the dummy or don't give them the iPad. What is that? What purpose is that serving? But for I guess for parents to be aware that it's really important that young children learn to wait, young children learn to entertain themselves. If they're typically developing, and even some of the less neurotypical children, we can teach them these things. We can teach them these skills because they're life skills. They don't need to be entertained.
And what we do for them now matters for decades to come.
Absolutely.
And this is the thing that I'm really passionate about, because, we all know, why sugar is bad, or why exercise is good, or why devices are not good. But sometimes we forget the reason why. And I think when parents understand the reason and the implications of what happens now in the future, maybe that motivation propels them on to be a little bit more hands-on and be a little bit more mindful. So let's move to the language and speech now. And, you know, I think we've kind of have a little bit of understanding what are some of the causes of delay. So, I mean, devices and less of interaction of parents or family with the child. What are other factors that you see in your practice?
Yeah, so it may be children with an autism spectrum disorder often have delayed speech and language. It may be children who have hearing, you know, early ear difficulties, lots of ear infections. They're not hearing properly, so it makes it more difficult for them to learn how to say sounds correctly. It might be children with, you know, syndromes like Down syndrome, cerebral palsy. There can just be children who are delayed. They're just a little bit slower at learning, you know, the speech sounds and then how to use sounds to make words and use words to give meaning. We see children with specific motor planning disorders, childhood apraxia of speech, for example, where the messages from the brain just aren't getting to the muscles correctly. Makes it very difficult for them to make speech sounds. They're bright children, they can talk, but it's very, very difficult to understand them. Yes, there's a whole range of
And apart from
reasons.
things that are not diagnosed, I mean, what you mentioned, and we can talk about them a little bit later, apart from those, is there a variety in the time frame where children start to speak? Can you tell me a little bit about how many words at what age,
Sure.
for example?
Sure. So just like learning to crawl, learning to walk, learning to eat, learning to talk, they're all developmental. So we see it happen in stages. So in that first 12 months of life, we'll see a baby start to babble more, start to make noises, maybe start to imitate what you're saying. If you're saying woof woof, they might say woof woof. Start to just acknowledge that if you've said something, they say something back, and that might be ah ga 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 ga. But that's their way of engaging in an interaction. Around 12 months of age is when we get single words start to happen. It might be things like da-da, ball, woof woof. It might be animal noises. It might be toot toot. You know, we kind of class them as words.
Yes.
So around 12 months of age, we'll have those single words happening. Somewhere around 18 months, we start to have a kind of a word growth spurt, and children, babies, will develop up to about 50 single words. And then at about 2, they'll start to put those words together into little 2-word phrases. So all gone, mummy up, daddy tar, you know, doggy running, some of those little phrases. That's a very general guide. And just like with children learning to walk, you know, there might be 6 months, you know, 4 to 6 months variation.
There's a variation
within that. I think the important thing to look at is the child actually trying to communicate with you, whether they've got 10 words at 12 months or 50 words at 18 months. What is their non-verbal interaction? So what is their eye contact? Are they trying to engage with you, or are they just dissociating themselves and, you know, not wanting to engage? Are they using facial expressions to get their meaning across? You know, are they kind of smiling at you and then looking at what they want? These are all non-verbal ways that a child can communicate before they have words. And it's often the non-verbal communication that we see is a challenge for children who then go on to be diagnosed with autism. For example. So we want to be looking at not just are they using words, but how are they using non-verbal communication, and what is their social interaction? Are they trying to engage with other children, with family members, with other parents? Are they trying to get attention? And so I guess that's the communication side of it. And then the other side of it is the language. Are they understanding what words mean? So at around 12 months, children will start to understand single words. So you might say up and they might put their arms up. Or you say doggy and they'll look to where the doggy is. Or you say daddy's home and they'll look to see where daddy is. And then as, you know, over that next 12 months, they'll start to understand more complex concepts. They'll start to understand longer sentences. They'll start to understand concepts like prepositions. The ball is in the bucket. The book is on the shelf, you know, so they'll start to be looking in things or on things or under things. So they start to actually understand the intricacies of those words.
And that's around 18 months?
Around 2 years for some of those intricacies, but developing, being able to understand longer sentences, you know, where's your nose and your ears, you know, so 2 parts to a sentence. That all happens between 18 months and 2 years, and then obviously progresses on after 2 years. So we're looking both at speech sounds and being able to say words, but we're also looking at understanding what those words mean and do the children understand what those words mean.
Fascinating stuff, and thank you. This is, I think, very useful information for parents to just have a little bit of an idea as to what to expect at what point, but also it's all about not worrying too much and enjoying the journey, correct?
Yes. The more that you can experience with your child, the more you're naturally building in opportunities to talk about it, to laugh about it, to remember it, to give those learning experiences. Going for a walk, you know, to the park, having a swing on the playground, you can be practicing counting. 1, 2, 3, you know, stop, go. There's so many opportunities to jointly experience, and then through that the children are learning and you're teaching them as well. You don't need to be a teacher, you don't need to be a speech pathologist to do this. It's just commentating what you're actually doing with your child, which is really tricky if you're both on devices as well. You know,
and this is what we find. You know, I mean, this is a challenge that we have as a society, that we are so drawn in, and you know, and the addiction. You know, when you read books like Stolen Focus, you know that by design we are actually drawn into these, you know, social media platforms, etc. Very interesting when you were talking about how these issues are managed, and I see that it's so interdisciplinary, that, you know, there is no miracle cure, that is no one single reason for issues if they're perceived to be issues. So, you know, we have a variety or a group of various experts that can inform or can treat the situation, as well as the tribe that the family has to raise this child, because I mean, Homo sapiens are developed in the context of the tribe, haven't we?
Yes.
Yeah, and then suddenly we don't have this tribe anymore, and I think part of that is what we are experiencing. What is some of your advice, or what are some of the tips that you can give young parents in the first 2 years of life?
Yeah. I think the first thing is to acknowledge that it's super hard. It is really tricky being a parent. And I think to also acknowledge that babies and children learn, as I said before, in developmental sequences. So there's going to be easier times, there's going to be harder times. When a child is going through a developmental burst, for example, they might be learning how to sit up or how to hold their head up. All their brain power is going into learning that skill. And so something else has to kind of fall off the bandwagon at the time. And it might be that their sleep regresses a little bit. You know, some people will talk about wonder weeks. It might be that they're a little bit more irritable because they're putting all their focus in learning this new skill. So over those first 2 years, we'll see peaks and troughs of baby, you know, doing really well, baby not settled, not sleeping. We often see when, you know, babies might be feeding really well and then they're learning how to sit up. So all their brain power and muscle energy is going into that core strength and learning to sit. The eating might, you know, fall back a little bit, and they might just want their safe, familiar, you know, favourite foods because that's easy, and their brain can't cope with, I'll learn new foods and new textures, and I'll learn to sit and I'll learn to, you know, be awake for longer periods and I'll learn to babble. Can't do all of that at the same time. So those first 2 years are really, you know, like 2 steps forward, 1 step back, and that's normal and that's okay. Everything is just a phase. It will pass. I think if you're aware of, you know, aware of typical milestones, is my baby interested in, you know, sitting up and looking at the world around them? Are they starting to show an interest in other people eating? Are they starting to be social and have a look at what's going on around them and want to be a part of that? Are they starting to copy sounds and words? You know, if we're seeing the trends, the age doesn't matter so much as to, they're 12 months and they're not yet saying, you know, 10 single words. If everything else is pointing in the right direction, it might be that they're just, you know, a couple months down the path, they'll be there. So I suppose looking at the big picture, trying to enjoy the moment, trying not to be too anxious about various things because that makes you more stressed. And if you're stressed, your child is going to be stressed. Is this a reasonable thing to say? It is very reasonable to say. And obviously children, you know, run off our body language as well. And if they feel our stress, they feel our excitement, they feel our joy. I think equally if a parent is concerned, then we need to acknowledge that concern and either alleviate the concern or, you know, say, well, actually, there's a couple of things that we could do just to, you know, help move things along. As health professionals, we can give those little tips that might just help the parent go, okay, a couple of strategies and now they're, you know, now they're on their way. So I think it's always important to acknowledge that if it's a concern for a family, then we don't just brush it off and say, well, there's nothing to worry about. We actually look at why they think it's a concern. Developmentally, is it a concern, or is it just that these parents need some reassurance that that actually this is okay? Here are a couple things you can do just to keep on the, you know, on the right track and just try and nip that in the bud before, as you said, it becomes too much of a worry for parents. That's right. I mean, you know, I was thinking about what you were saying about mindless eating while you're in front of a device, and you know, you probably won't learn what satiation feels like. So that might then, you know, lead to a child that is, you know, leading towards the childhood obesity or diabetes. So, you know, how do we change the trajectory of growth towards health rather than towards ill health? And that's something that, you know, it's very, very important if we are to have a healthy society for the future of Australia. And I think it goes back to, you know, back in my grandparents' era, you sat at the table as a family, you know, you ate what was provided, there was talking, there was communication, there was an expectation that, you know, children set the table, clear the table, help with the food preparation. I think in today's society, with working parents, with a lot of convenience foods, with children seeming to do 700 extracurricular activities that have, you know, us as parents driving here, there and everywhere at all hours of the night, we've lost a lot of that kind of family time where a lot of the learning happens. And so finding ways that we can actually bring back that family time, those family meal times, that mindful eating and mindful learning, I think is super important. And it is achievable. It's just looking at what can work for each different family. Going back to basics, going back to old wisdom. old-fashioned, some people would call us.
Well, or progressive, perhaps. I don't know. Depends how you look at it, but what lens you look at it through. Well, thank you so much, Emily. This has been fascinating. Is there anything else that you'd like to add? Your closing remarks for parents?
I think it's wonderful, Rosh, what you're doing with this podcast to give families an opportunity to learn that there's lots of different aspects of, you know, what someone might call normal, and just to enjoy your babies, enjoy your children. Everyone says they grow up in a blink and they're gone. But you as parents have the most powerful job of, you know, teaching your children all that they can learn.
Thank you so much, and thank you for all the hard work you have done as well.
Oh, thank you.
Beautiful.
No,
thank you so much.